Hi, Phil Colcord here with Fraternal Police, Evergreen Lodge 1 in Kitsap County, and this is our outreach program. Our guest today is Poulsbo Fire Chief Jim Gillard. Welcome aboard and glad to have you here, Jim.
Thank you, Philip. I really do appreciate the opportunity.
Can you tell me a little about you?
Oh, sure. Jim Gillard. I am the Fire Chief of the Poulsbo Fire Department. Worked for the Poulsbo Fire Department since 1996, where I was hired as a brand new firefighter EMT. Been privileged to spend my whole career with the Poulsbo Fire Department. Been the Fire Chief for the past about 5 years. And the Poulsbo Fire Department, we do serve the city of Poulsbo, but we're a separate fire district, serving unincorporated Kitsap County from Keyport up to Port Gamble, including the city of Poulsbo. And right now we have 59 full-time employees, 50 of which are firefighters, and all of our firefighters are both EMTs and paramedics, which will be a little bit of the subject of our conversation when we're talking about EMS.
Yeah, good. Yeah, the fire department, actually I'm jealous having worked in law enforcement. You guys came a long way. When I first started, we were made EMTs, so that because there was all volunteers on the ambulance crews. And so we became EMTs so that we had somebody with some medical knowledge that show up at accidents and stuff. And fire departments were all volunteers then too, mainly except for I think the chiefs. But yeah, you guys come a long way.
I started as a volunteer in 1989 out in Issaquah, and it is amazing to see where the fire service has come, but it has absolutely been a great career being able to serve the community.
Well, that's good. And, and getting to know the community when you stay in one place. It comes to your heart.
Absolutely.
So there's this new thing that I never heard of. In fact, we called you guys, we were at my wife's, 50 years, they ended up with a class reunion deal. And ever since then, they do a monthly lunching. And we were at the Kingston Park doing a lunching, and one of them that had some medical problems had a problem, and we called, and fire department showed up. Anyway, CARE. And tell me a little about the CARE team.
CARE team. So it's an acronym, stands for Community Assistance Resource Education Services. Not a big fan of acronyms, but that's what it stands for. Really, our CARES program, it consists of a firefighter and a social worker, and their full-time job is to prevent emergencies from happening out in our community. Kind of our mantra with the group is to go out in the community and do good things. So the way they prevent the emergencies from happening is getting referrals from law enforcement and fire from our EMS units that respond. They get referrals for members of our community who are calling 911 multiple times, or instances in which people, they get the impression they're vulnerable to have multiple 911 calls or need our services again in the future. So they're referred to the CARES team that goes out into the field, into people's homes or into homeless encampments if that's necessary, and make contact with people. And to the extent that folks will accept their services, they meet with them, they try to find the core problems that are causing the emergencies to happen and try to link them with the resources to prevent that emergency from happening. The best way I can describe the CARES team is to give an example. This happened fairly early in our CARES program, which has been going since 2021. Our CARES team was notified of an elderly gentleman who was wheelchair bound in front of one of the local grocery stores. And they had the report that he had no resources, no food, no place to stay. So our CARES team made contact with him, confirmed that he had been removed from a halfway house for violating their rules, no family, no food, no resources. This is someone who was on the verge of homelessness or being unhoused, and very likely being someone who is going to need emergency services if they didn't receive care. So our CARES team spent some time with them. They were able to contact and find a alcohol treatment facility in Tacoma that would accept him. They were able to coordinate transportation from him from Poulsbo to the treatment facility, and then worked with the halfway house to reaccept him into the halfway house if he completed the alcohol treatment program. So I don't know how that story ended, but I do know that that brief interaction with our care team, maybe an hour, gave that gentleman a chance to turn things around, to get the treatment he needed, to get back into a housing situation, and to be supported. Without that interaction, very likely that's someone that would go into crisis, need emergency services, need 911 to respond or law enforcement to respond, need to be treated at the emergency department. So that's really what our CARES team is trying to do, is to find those situations where they can make a difference and prevent that 911 call.
The other thing that when that picnic, they called for aid unit, the care team heard the call and they were right there.
Yep.
And so they were there in seconds to make sure everybody's stable and there's no problem there, which it's really nice to have those extra people out there that, if they're in the area, they're going to respond and they're going to help. So that's good.
Yep.
Where did the idea for the care team come from?
Well, it's definitely not unique to Poulsbo. We like to steal great ideas from other places. Actually, in 2015, the Washington State Legislature enacted law that enabled fire departments to form CARES teams in partnership with social service providers or local hospitals or medical providers, with this purpose of locating people in our community who are high utilizers of the 911 system, especially for low acuity or minor incidents, and be able to find them the resources they need to prevent those emergencies from happening. So it's a fairly well-proven model, been used for several years by several of the fire departments. Really, it was piloted and brought to the state by a couple of larger departments, Spokane, Bellevue, and Tacoma. We're really the leaders in bringing this type of program to Washington State, and we're very appreciative of that. Locally, it was really spearheaded by the City of Poulsbo's Health and Human Services Director, Kim Hendrickson. She's the one who brought it to our organization and said, hey, how about this? The timing was absolutely perfect. We were going through a lot of transitions as an organization and really trying to embrace and going through the process of embracing prevention, including fire prevention, into our core functions of our department. This fit perfectly well with that concept, and really just taking that concept of fire prevention, so much more efficient to prevent a fire from occurring and stop the tragedy from happening, the same concept with EMS and trying to become much more efficient. So we started the program as a partnership with the City of Poulsbo. We got some great grant funding from Kitsap County. The City of Poulsbo provided the social worker and the administrative oversight, and then the team was housed within the fire department, and we provided the day-to-day management. It's been a great collaborative effort, and it is amazing what a popular program it's become in our community.
Oh, good. That's good to hear a success story. What local fire departments provide this service?
Well, we've been providing this service since 2021. Central Kitsap Fire and Rescue just started their CARES program in a very similar model to us, and with assistance also from the City of Poulsbo. They just started their program at the beginning of this year. South Kitsap Fire and Rescue has every intention of starting their CARES program in 2024. Port Ludlow Fire and Rescue in Jefferson County, they implemented theirs in 2024 as well. 2023, the same time as Central Kitsap. Bremerton Fire, they have a similar program, but they do it rather than their firefighters involved, they do it through a partnership with Peninsula Community Health. And then for our program hosted in Poulsbo, we have a great working relationship with our neighbors at North Kitsap Fire and Rescue and Bainbridge. So our CARES team provides service to those communities as well, which allows for the entire county to have access to this kind of resource.
So you're blanking the entire county,
Yes.
which is good.
Yep.
That's good. So how are these programs funded?
Funding, that's a challenge. So we've been very successful in getting grant funding. A lot of that has been through the work of Kim Hendrickson through the City of Poulsbo. She's absolutely masterful at finding resources. We implemented our program with a grant funding from the Kitsap County's Substance Use, Mental Health, and Court Diversion Tax Program. I probably got that name wrong, which funded our social worker and firefighter for the first year. Then we were able to get an additional grant from the Washington State Legislature that provided some additional staffing with a social worker, and we were able to train additional firefighters in the crisis intervention that they need to participate in the program. More recently, Central Kitsap Fire and Rescue's program is being funded through a 6-month grant from Association of Washington Cities. And we're just implementing a new grant through the Olympic Community of Health to provide a full-time substance use professional throughout the county. And another grant that we're implementing through Kitsap County to implement a fall prevention program that our EMS medical program director has been very adamant about and advocating to implement in the county, which is really exciting. The challenge, though, is this has been grant funding. So for Poulsbo Fire, it was grant funded. The firefighter was grant funded for the first year. We saw how successful this program was in really helping our community and preventing emergencies from happening. So we took over funding of the firefighter, and we really have a firefighter dedicated to the position of EMS prevention, and the social worker is grant funded. But the challenge is grant funding isn't sustainable, and the fire departments are really looking for sustainable funding to make sure we can continue offering these services in the long term. We have been working with the Washington Healthcare Authority. There is some very, very small remuneration for fire departments with CARES programs, but no real funding for the activities of the CARES team. And it's part of a bigger healthcare issue that we struggle with, and so much of healthcare struggles with, is the incentives are to provide the medical care, to treat the injury or the illness. If we respond to an elderly person who's fallen and we transport the person through medical insurance or Medicare, we get reimbursed fairly well for that transport. We don't charge at all for the emergency response, only for the transport. But now that person goes to the hospital, and very expensive to be seen at the emergency department. That is very expensive to the system. What we're offering is that potential for that same person to meet with our CARES team, link them with a physical therapist that can do fall prevention services for that person or treat any ailments, link them with the numerous community service organizations in the north end of the county that are more than willing to come in and install a wheelchair ramp or grab rails to prevent the fall from happening. How much cheaper that is, and better for our community, better for the patient than waiting for the emergency to happen. It's just hard to sustain that because there's no funding for that prevention piece.
Right, I understand. I know physical therapy is it's a godsend.
Yep.
Most people don't realize it. I didn't. In fact, they tell you some simple little things to do, and you're thinking, that ain't gonna work. But it's amazing how well they work.
Absolutely.
And you just have to. I have some from the last time I had physical therapy that I put into my daily exercise routine because they're a godsend.
Absolutely.
Good to have. Now, I know when I had Kitsap Mental Health here, we talked about funding and different things, and they have teams that are looking for additional funding all the time because the federal government puts out a lot of funding every year different. And so it's good to have one there that's looking for these resources to be able to find them to help. And they're good starter programs, but like you said, you need a program that's going to go on so the project can go on. And from what you're telling me, these programs are all the same, but they're all different.
Sure. So every CARES program that exists, and there are a lot of them throughout the state of Washington, they're all tailored to meet the needs of the community, which isn't just the socioeconomic standpoint or standing of the community and the patients, but it's also filling the voids of community services and what's available and what isn't available in each community, because it changes. So our CARES program, it has a high focus on the social work side of it, but really oriented towards elderly in our community. About 40% of the people that we provide service to are over 65. So we provide a lot of fall prevention services and medication management, resources for depression and loneliness, those sorts of things. We also deal with homelessness and substance abuse in our communities, but it isn't as extensive as other areas. So that's kind of where our program is focused. When we talk about CARES, there's really 3 different styles or focuses that CARES programs focus on. And it's usually a blend of those, but there's different services. So ours really focuses on the social work side of it, that follow-up to the 911 call, linking the individual to the services to prevent that future 911 call. Another style is mobile integrated health or community paramedic programs, where that team actually provides more medical care in the field, doing medication management, wound care, those sorts of things, where they're actually providing medical care. And there's some really exciting developments with a partnership with St. Michael's that we're looking at that could drastically expand our program into that field. The other aspect is crisis response. And that's going to someone who's actively experienced a mental health emergency or a substance abuse emergency, where they can respond and provide the mental health professional to support fire and law enforcement. And that is something that we see as absolutely critical to get the right resource to people who are experiencing those issues. A lot of times, the fire department, we need to be on those scenes to make sure that there isn't something else going on that may appear to be a mental health issue. Diabetic emergency, traumatic brain injury, infection, those sorts of things. And we're really good at stabilizing the scene and treating people's medical emergencies. A lot of times for people in acute emergencies, we need law enforcement there to make things safe, not only for the public, but also for the emergency responders. And that third tier that's coming into fruition is that mental health professional who's trained specifically in de-escalation, can talk the person out of that mental health emergency, supported by medications that our paramedics can give. That's where we're really trying to get, is that true co-response model to get the appropriate resource that individual needs in a safe manner.
That sounds excellent to be doing all that. Which brings, I learned something from you today, and I don't know how many people out there know it, so I want to make sure they know it. 988 hotline.
Sure.
Can you explain what that is?
Sure. 988 is fairly new. It is.
You dial the phone, right?
Yeah.
988.
It's the 3-digit number for people with suicidal or mental health crisis that's low acuity. It is an absolutely fantastic resource for anyone suffering from depression or mental health crisis, and they need resources, but they don't feel like they need 911. It's staffed 24 hours a day, 7 days a week through call centers with people who are trained to get people resources to help them get through that crisis in those low acuity cases. It is an amazing resource. So what we're working through right now is there is no direct link right now between the 988 system and the 911 system. So there is a committee called the CRIS Committee, Crisis Response Improvements Services. I'm going to get that acronym wrong. They're working with the state legislature to develop the system for responding to projecting resources out into the field for those folks. And where we want to be involved in that is, one, just the benefit of the co-response model of embedding a mental health professional with fire or law enforcement to get to those scenes quickly to provide those services. And the area that we really have a vested interest is for the higher acuity calls that should be in the 911 system, to make sure that fire and EMS, and in most all the areas in Washington State, fire is the primary EMS provider.
This 988, is that just state of Washington, or is it national?
No, it's national.
National.
But making sure that when these cases are more acute, more serious, that fire and law enforcement can quickly respond to those to stabilize the scene, not only for the individual who's suffering the crisis, but also for the public.
Okay. We're starting to run out of time here,
Okay.
so I wanted to ask you, can you provide us, the community, with an update on fire department and St. Michael's Center.
Sure. We had a lot of struggles with St. Michael's last year and the emergency department wait times. Lots of media attention being given to that, with our crews regularly waiting over a half an hour to transfer our patients into the care of their emergency department staff, times up to 6 hours, and just really struggling. So a lot of that came out in the public and it got a lot of attention. What came from that was a lot of work between the fire chiefs, elected officials, St. Michael's leadership to mitigate that problem. I have to commend St. Michael's leadership. They have put a lot of time and effort and resources into upstaffing and restaffing the emergency department, giving them the support and resources to function more appropriately, but also gave us a much better appreciation for the bigger healthcare issues that are affecting St. Michael's and hospitals across the country. Overuse of the emergency department for low acuity issues, which stems from a lack of primary care or barriers to getting primary care or mental health. So the fallback is the emergency medical services and the emergency department. Issues with the hospital not being able to discharge patients to long-term care facilities and those patients backing up. A lack of healthcare professionals in the workforce, and just the amazing things that are happening right now in Kitsap County with Olympic College dramatically increasing their capacity for healthcare training programs. And in the future, their plans are to provide a paramedic training program in Kitsap County, which would be absolutely amazing. Kitsap Public Health, under the direction of Dr. Gib Moreau, they partnered with Johns Hopkins University to create an overarching evaluation of healthcare in Kitsap County to focus on that lack of primary care, the impacts of the Naval Hospital closing, and all those patients coming into the St. Michael's system.
Let me ask you a question.
Sure.
On that, and then we're about out of time, but the St. Michael's, it's better now?
Unequivocally, yes. I think they're doing a fantastic job.
Good, good. And are they still struggling with staff, or they got that problem?
Probably a great question to ask their staff, but from our perspective, things have dramatically improved.
That's good.
I've been very impressed with them. There's still challenges. We're not done yet.
Oh, I understand
with
that.
Some of our work, but
it's a godsend to hear that they're improved and they're getting better.
To be clear, one thing that I think we really tried to communicate, while they struggled with ED wait times for low acuity for people who weren't seriously ill, throughout that entire time, they did an amazing job. When people were truly sick, cardiac events, they're a level 2 cardiac care center, a level 3 stroke center. When we had people who were truly sick, they got them care immediately, and they maintained that level of service, which I was very impressed with.
Well, good. Anyway, I thank you very much for coming in. You have a lot of good information we could pass on to the community, and you're welcome to come back again down the road if you'd like to do this again.
Well, thank you, Phil. I appreciate the opportunity.
Thank you.
All right, thank you, sir.
Okay, just sit there for a minute.
Okay.
That ends our show. We appreciate you listening, and we'll have another show coming down the road here, and you guys have a great day, safe time, and if you need help, remember 911 and 988 are just a phone call away. So take care and God bless.
Thank you.